It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And you are listening to part 2 of the interview with Dr. Stephen Sinatra. So we are going to jump right into that program.
We're so glad to have Dr. Sinatra back, and we're glad to have an opportunity to share his wisdom and knowledge with you. I tell you, Dr. Sinatra is one of the leading physicians in the country on natural approaches to health, and he's a board-certified cardiologist out of Manchester, Connecticut. He's written numerous books, and we'll give you contact information as the show goes on. So let's go right into the interview with Dr. Sinatra. Last things, I want to talk about high blood pressure. Now, folks, you know you go to the doctor's office, and you get up, and you're nervous. You get up on the table, and they check your blood pressure, and doctor leans over with his glasses down. He goes, "You got high blood pressure." Well, you know exactly what that means. He's going to put you on a blood pressure medication. He's not going to tell you, look, you're overweight, you don't exercise, you're probably nervous because you're in here and your pressure's higher. I want you to get a blood pressure cuff. Let's check your blood pressure at home. Let's get you on a good, healthy eating lifestyle. Let's get you on some magnesium for crying out loud, some vitamins and minerals, and let's get you exercise. And let's have you back in a month, and let's see what your pressure does. They don't do that. That doesn't happen. And I don't know why, but we see them in here all the time. 25%, the studies I've read, 25% of the people that go to a doctor's office have high blood pressure because of the white coat syndrome. They just do. And they take the pressure at home, it's fine, but they go to the doctor's office. My wife said somebody goes through the ceiling. She walks in here and it goes through the ceiling. We don't even wear white coats. And she gets
it. Well, remember the other thing is a lot of doctors' offices and it's technology. I mean, a lot of computers, Wi-Fi, they can drive up blood pressure in the direction of it being much higher because it stimulates sympathetic discharge. So it depends on how wired a lot of these offices are, with wireless technologies. That's why the phone I'm talking with you right now is a wired telephone. I don't have, cordless phones in my house. All my computers are wired in the house. I mean, you don't want the wireless because the wireless itself, can be driving up the numbers of blood pressure. That's why it's so epidemic in our society today.
That's fascinating.
One of the reasons.
That's fascinating. So
and remember, when you ground,
you neutralize
you're discharging all that electromagnetic activity. That's why grounding is so important for our health right now.
Right. We're going to come back to that. Let me just finish up on the blood pressure. So on blood pressure, if somebody were to come in, what would you recommend to them if their blood pressure is not extremely high, but it's elevated? It's 140 over 90, 150 over 95 or something, They're coming in first time. They're worried about they got high blood pressure. How are you going to handle that? How do you handle that?
It's so simple. I mean, dietary therapy, number one. I don't like to have them eating out of cans or boxes because of all the sodium chloride and all the salts in there. So, I put them on a lot of fresh fruits and vegetables and, organic meats and certainly seafood, omega-3s. I mean, you live in the Houston area, so I'm sure there's lots of good omega-3 out there. And omega-3 is, one of the best things of lowering blood pressure because of, endothelial. It supports endothelial cell function. I love coenzyme Q10. I've been using coenzyme Q10 for decades. Coenzyme Q10 with omega-3 will lower blood pressure. Magnesium is my go-to supplement for blood pressure lowering. Then there's so many other things. You can use resveratrol. You can use magnesium. You can
vitamin C.
Vitamin C. Anything that has a nitric oxide effect.
Right.
You can use even grapeseed extract. I've used. So there's lots of things that you can do for patients with high blood pressure. Certainly, weight reduction works. Reduction of stress. I mean, I'm a psychotherapist. And the reduction of the electromagnetics. The list goes on and on and on. And we just published a study. I supported the study, but my name's not on the paper. But I helped the cardiologist devise the study. But I got to tell you, 12 patients all lowered their blood pressures with simple grounding.
Yep.
So, there's so many things you can do to attenuate the hyperstimulated autonomic nervous system. So when it comes to blood pressure, there's lots of tools in our chest that we can use, other than pharmaceutical drugs. But if you have to use pharmaceutical drugs, certainly,
you can. What would you say percentage-wise, patients that have high blood pressure that are coming in on blood pressure medication, what percent can you get off of the blood pressure medication and reduce their blood pressure naturally?
Totally off?
Yeah.
I'd say 60 to 70%.
Yeah.
Totally off.
Yeah, and we do it here. I just do it with, well, of course, we have a whole plethora of vitamin and mineral support we do. For my omega-3, I use, of course, you can use fish oil, but I use cod liver fish oil. That's what I take.
Okay.
I take a tablespoon of that every morning, whether I need to or not, and do it in the evening too. That's my go-to. Another thing now, I'm gonna ask you. So folks, just know from a cardiologist, he says he can get 60 to 70% of the patients off blood pressure medication using his natural nutritional support diet, exercise, vitamin and minerals. That's what.
And stress reduction, yeah.
And stress reduction.
And grounding.
And grounding too. And we're going to come back and we're going to talk about that grounding. So these are some modalities, some treatments you can use that are natural, that don't poison your body. Doc, I'll tell you something. My dad told me the night I graduated from med school, I was here at University of Texas in Houston. This goes back to 76, July 30th, 76. He turned to me over a dinner that he was hosting for me at the Houston Club. I'm the oldest of 7 boys and a girl, and I was married. And so we were there with friends, and he had this nice banquet for me. And he turned to me and he said, "Son," I said, "Yes, sir." He said, "Son, don't poison your patients like all the other doctors do."
Oh, wow, what a gift.
He planted that seed in my mind, which eventually gave birth to the Hotze Health and Wellness Center, and it was through his heart problems back in '88 when he came to see me, and I sent him to a cardiologist. He said he had a blocked LAD, and they were going to do angioplasty and tore it open during the procedure. And I'm watching it through the window, watching into the room. We take him, have emergency bypass surgery and all that. And he, 2 weeks after he got home from the hospital, he lived through it, thank God. And he had a massive heart. He had congestive heart failure because it had damaged his heart. It was just a mess of a heck. And he goes, "Son, I don't know what the Sam Hill I was thinking. Let these doctors invade my body like that. I'm telling you what. I'm an engineer. I got calcified arteries, and they're gonna stretch them. Really? They're gonna blow them. They put pressure on them. They're gonna crack them, and that's what they did. I don't know what I was doing." He said, "Here, read this article." And he gives me an article by, I know you know him well, is Dr. Julian Whitaker. He gives me one of Whitaker Wellness newsletter. He said, "What do you think of this?" I said, "Let me read it." I read it. It was on heart disease. At that time, if you have a heart attack, and this was 1986, 87, 88. 88 is when this happened, but the article was somewhere contemporary to that. It said 15% chance of mortality after angioplasty, 5% after bypass surgery within the first year. Well, if all you do is lower your blood pressure, lose weight, exercise, take some vitamins and minerals, you got a 1% chance. And don't let the doctors invade your body. And my dad said, "Well, son, what do you think about this?" I said, "Dad, I wish I'd have known about it. I didn't know about it. We'd have tried it." He said, "Well, this doctor says I need to take vitamins and minerals. What do I need to take?" I went, Dad, I'm a doctor. What do I know about vitamins and minerals?" And he goes, "Son, would you find out, please?" I said, "Yes, sir. I love my daddy," and I did.
He was your messenger.
Yeah, and so God used his adversity, the adversity in his life, completely got me turned around on there were seeds of equal or greater benefit. And my dad lived, he should have never, the cardiologist told me later, he said he should have never got out of bed for a year and should have never been able to get out of bed, should have died within a year. Well, he walked 2 miles every day, and he ran his business every day with 365 employees. And the night before he died, I called him up on the way home from the office where I am now, and I said, "Dad, how are you feeling?" He said, "Son, I hadn't felt this good since I was 18 years old. My food hadn't tasted as good." And then the next day he had a cardiac arrhythmia going somewhere, and he died, just like he said he would.
And how old was he?
80 years old.
Yeah, oh, geez, he had a good life.
He had a great life, but if I knew what I know now here's something that we do here at the, I do a heart scan on all our guests that are males 40 and over, women 50 and over. We do a heart scan to check and see if they got any calcification in their arteries. And the reason I do that.
Oh, you have an EBCT
yes.
equipment there? Oh, great.
So we do that, and I'm a big advocate of that because I believe when you show your patients, your guests, we call our patients guests, you show them they've got a problem with calcium in their arteries, got atherosclerosis, that's a wake-up call. They're going to do what you say. They're going to go, yes, sir, whatever you do. Yes, sir, I'm going to eat that. I'm going to eat right. I'm going to lose weight. Yes, I am. So you got a blocked artery. We got it. It's the only non-invasive way we can really check and see a calcium score. Now, what we found, so I have a regimen. And one thing, I follow the Linus Pauling Matthias Rath view on heart disease and inflammation, and use copious amounts of vitamin C. As a matter of fact, I can't get my doctors to be as good as I am. They always recommend vitamin C, but I always recommend 1,000 milligrams per 25 pounds of body weight, because that's the average of the mammals that make vitamin C. That's how much they make. And so I've taken, since I first heard Linus Pauling, I've taken 10,000 milligrams a day, and I now take somewhere around 20,000 a day. That's just what I do, and I encourage all my patients to do that, because I believe that cuts down on the inflammation in the coronary arteries and all that. So we have a regimen we put people on when they have the coronary, when they have the calcification of the arteries. We put them on high dose of vitamin C. We'll put them on L-proline, L-lysine, put them on K2. We got them on magnesium, coenzyme Q10, fish oil, all the down. I mean, I have a whole list of things that we give them.
How much K2 do you use? How much metaquinone 7 do you use?
Gosh, I want to say it's. Am I thinking wrong? Is it 99 milligrams? I don't know offhand exactly what. I don't know offhand what the dose is on that.
I've always found, when you use vitamin K2, you got to use metaquinone 7. Metaquinone 4 doesn't work, and the dose the minimal dose you need for metaquinone 7 is a minimum of 150.
Okay.
I usually recommend 300 a day.
Okay.
If they have plaque.
We may do that. I don't know how much is in the bottle. I put them on K2 in such amount. I'm blanking on that. And frankly, so we put them on a host of these things, and then we have them come back in a year, and let's just check. Yep. Normally, I do it in 6 months and then in a year, because I want to see if we have arrested and reversed. Because according to Matthias Rath in his studies, it grows 30 to 40% a year. The calcification. So if you have 100, next year's going to be 130, next year's going to be 170, next year's going to be 250, and then it begins to grow at an exponential rate, because you're growing at 30% a year. Well, if you can show it only grew 10%, or it stopped and then it's regressed, well, my wife comes in, and I said this a couple of years ago, I said, baby, let's just get a CAT scan on you. I've done it on me, mine's 0. I got no calcium. And I believe, and I attribute all the vitamin C I've taken for years to doing that. For whatever it's worth, that's what I believe, and that's because I hold to Matthias Rath and Linus Pauling's theory of mild scurvy causing the coronary artery disease. So anyway, I check hers, and she's got a score of 365. Oh my gosh, she is petrified. Oh my gosh, she got hardening of the arteries. She had renal artery stenosis, so she has elevated renin, and she's on an ACE inhibitor low dose, and has been for years. So anyway, so she's got this, and then she says, well, she hadn't been eating right, gained some weight, been eating too many carbs, and hadn't been on the vitamins for a year because, she thought it made her have loose stools, and she'd been taking them for years, but hadn't taken them for the last year. But so I sent her over to see a cardiologist friend of mine. And he did a stress EKG and an echocardiogram, and then he did the nuclear thallium stress. Well, the first two were absolutely normal, but he does a thallium stress, and the posterior wall of her heart's just black as the ace of spades. And he goes, I'd send you a cardiologist, and they put a stent in there or do something. But he said, you can clean this up just using eating right. And he's got his eating program, which is no carbs, cut your carbs out, fast 2 days a week, 48 hours, water fast, and on and on. And so she got on that, and 9 months later, her score had gone from 365 to 280. It had regressed.
That's huge.
Which is really huge. But she lost 25 pounds and got down to 123 and looks great. I told her this morning, I said, baby, you're looking thin and trim. Look at it. She said, I intend to stay that way. But
no, that's good. That's good plaque reversal.
Right. And what we want to do is I want to show here at our office that you can reduce plaque without having to go get bypass surgery. Now, there comes a point you get so much plaque, it's just hard to reverse it. It's kind of like an old rusted chip. But if you catch it early, we've been able to reverse it in patients. And so we're going to have an ongoing study of that. But anyway, I just thought I'd throw that in the mix about this whole concept of natural approaches to health and how I really got on that path because of what happened to my dad. And I'm grateful. And I tell all my patients, and I tell them over and over again, every drug you take is a toxin. I know that because during my first year in medical school, I took pharmacology, and there's a chapter on detoxification of pharmaceutical drugs. And you have to detoxify a toxin. Definition of toxins, poison. And I make this point over and over again. You cannot poison yourself to good health. You can't do that. It's an oxymoron. And that's basically modern conventional medicine really. Without saying it, their real underlying belief is we can poison you to good health. We can give you toxins and make you healthy. And when God's given the body amazing restorative power, if you'll put the right molecules in. And, of course, you probably agree with Hippocrates, and I do too, let food be your medicine, medicine be your food. Start first with food. That's the big start. Well, let's
That's why I developed Ravana. I mean, healthy food is the best place to start.
Spell. How do you spell the company?
Oh, it's Ver, VERVANA.com.
Vana.com.
So that's the best way for people to find you, Dr. Sinatra?
Yeah. I mean, that's my healthy food company, and we do olive oils and pastas, and I do a high protein pasta, and the pasta sauce I did in a green facility in Ohio. It's BPA free and all organic, non-GMO, all that stuff.
That's good.
I mean, you've heard of California Prop 65, right?
Yeah.
Lead and mercury.
Yeah,
yes. We had to assess for those values, and we passed California Prop 65, and I'll tell you that's going to be the challenge of the next century is a healthy food supply. It really is.
Mm-hmm.
So.
Well,
absolutely.
Well, listen. One last thing. Let's go to grounding and talk. As I mentioned to you beforehand, I had been encouraged by my pastor a couple of years ago to check out this whole idea of walking around barefooted like his dermatologist said he needed to do. And he asked me about it, and I ended up seeing something by Mercola online, and I ended up ordering the book Earthing, and I got it, and it was sitting on my desk in my study, and I was walking by looking at what am I going to read today on Saturday, and there it was. Dr. Stephen Sinatra was one of the authors of the book. I said, I'm going to take that. I read that. Then I went and looked at the videos, and then I learned now grounding. Explain grounding, Doctor. You're the expert in it. I might be able to explain it fairly well, but I'm sure you can explain it better.
It's very simple. I mean, the Earth is struck by lightning thousands of times, actually a minute, particularly around the equator. Now, in Florida where I live, it's like lightning all over the place, and in Connecticut where I live, there's very little lightning, but still, when lightning strikes the ground is has billions and billions, trillions of electrons in it. So if you walk barefoot on the beach, on the grass, on concrete, not on wood, not on asphalt, but if you walk on ceramic, it's okay. Stones is okay. So if you walk on, the natural earth, you can absorb these electrons through your feet. And basically in your foot, there's a K1 point, which is an acupuncture point that goes all the way around to the back of your skull. And when you absorb these electrons, it's like taking handfuls of antioxidants. It does the same job. And basically what you're doing is you're absorbing these electrons and you're attenuating the oxidative stress of the autonomic nervous system. I really believe that one of the reasons why we're seeing so much bizarre diseases today and hypertension and cardiac arrhythmia is, the computerized environments that we live in is really the antithesis of grounding. In other words, we're living in a sea of electromagnetic soup, and we need to discharge that soup, and the best way of doing it is by putting your bare feet on the ground. I mean, I sleep grounded. I believe in grounding with all my heart. I mean, even when I go to hotels, I bring my grounding sheets with me, and I just put them
right. I've always told all the people I know, Dr. Sinatra's a well-grounded individual.
He's very grounded.
Listen, Doc. So what I did is I went onto that website, Earthing website that Ober has or something, and I ended up buying. I bought the grounding pads for my bed, one for me and one for my wife's side of the bed. And then I bought it for some friends, and then I gave the leadership team, I have 12 members on my leadership team, I gave them all grounding pads that they can put on their desk or put down, and it's mostly women on the leadership team, so they stand at their desk barefooted on the grounding pads all day. And
you are healing so many people. That's fantastic.
I'm a quick start. So when I read about it, it made sense, and seeing you're on it too, that just gives me good confidence.
I mean, I'm barefoot right now talking to you.
Good. On the beach there, sitting there. Listen. Here's the deal. What does it cost? Nothing.
Nothing.
It costs you nothing to ground yourself.
Nothing.
Now you can buy the bedding pad, and it costs $99. But that's it. I mean, think about that for your health, and the long-term benefits of it are really remarkable. And you've shown, I know you did a study that you wrote about in the book where you had a group get together and test their blood and looked under a dark light microscope. And
that's the most amazing story of all time.
Tell me about that.
Incredible.
Tell me what happened. Tell me what happened. So explain that to our audience. What it does to the blood, grounding, how it affects the blood.
First of all, the day we did that study, I happened to be the Eucharistic minister at my church, right? At the Catholic Church. And would you believe somebody has a cardiac arrest in the middle of church? So here I am in my gown, right? I had to address this person. We called the paramedics, and we go back to the service is over. And I go back to this room where I had 20 people, and now we're doing a medical experiment on grounding, okay? Well, since I ground all the time, we tested my blood first while we were in this office, and my blood was like red ketchup. I said, oh, my God, how can that be? I ground all the time. I sleep grounded. But then I had to deal with this young boy with a cardiac arrest, and I said, well, that clumped my blood, emotional stress. It made sense. So the next person, their blood was clumped, and the next person was clumped. I go, wait a minute, something's going on here. We all can't have red ketchup blood because these people are scientists. In fact, I had Dr. Pericone's physicist there. I had artists. I had lawyers. I had Dr. Pericone there. I had Dr. Delaney there. I had medical doctors who ground. Guess what happened? Inside the office where we were drawing the blood, there was a cordless phone. And the cordless phone was putting out insidious, toxic vibrations that was making our blood thick. And I said, oh, my God. So I threw out the cordless phone. And then I had everybody go outside. And then we brought them back inside the building, and we retested the blood. Did went from red ketchup to red wine.
Did they go outside and ground?
Yes, that's what we did. I told everybody to take their shoes off. Walk on the grass, walk on the concrete, not on asphalt. And then we tested some blood, and the blood went from red ketchup to red wine. Then I called up my researcher, Gaetan Chevalier, one of our statisticians. I said, we got to devise a study on earthing because it thins the blood. He goes, are you serious? I go, yes, this is the greatest discovery that we'll ever make in our lifetimes. Sure enough, we did a double-blind study. We had 24 people in the study, and what we showed with 2 hours of earthing, the blood thinned 270%.
Wow!
So we got blood, and we published that, and it was one of the alternative medical journals. But I'll never forget this. I was on the phone with Ali Johansson from Sweden, and I said to Ali, Ali, this is the greatest research I've ever done. I've published in 50 or 60 journals. I said, I'm a reviewer for journals, for big journals, in fact. The American Journal of Cardiology, and I've reviewed for JAMA. I've reviewed for so many journals. And I said, I can't get my own study published in a standard medical journal. And he's laughing and laughing and laughing. And he says, Doc, he goes, you'll be dead and buried before they give any of your group the Nobel Prize because nobody believes this stuff. But he's right. Nobody would believe that putting your bare feet on Mother Earth would thin the blood, but it does thin the blood. And look, as a doctor, as well as I know, that it's thick blood. It's red ketchup blood that gives people Alzheimer's disease, cardiomyopathy, heart attacks, diabetes, you name it. Red ketchup blood is sludgy blood.
So you're saying,
in the Framingham study, we showed that.
So Dr. Sinatra, you're basically saying that our beloved cell phones are creating a situation where we could develop conditions like Alzheimer's.
Yes.
So,
Yes.
so
Whenever
for
you
those
use
of
a
us
cell
out
phone,
there,
never put it towards your ear.
I mean,
Don't
they're
even
probably
hold it.
so there are probably I don't know, not many people who love their cell phones, but for those out there who do, what would you recommend in terms of because so many people use it for work? So, what would minimize the risk? Just putting it in a different
Put it on
room.
speakerphone.
Okay, put it on speakerphone.
Yeah, and just don't hold it, but just put it on
So
your
don't
desk.
touch it. Okay.
And don't touch it, or have it at least 5 inches away from the body. I mean, look at all these males that are putting cell phones in their front pockets and they're sterile right now. I mean, the data on that's alarming. I mean, a cell phone in a front pocket of a male will drop sperm production 400% in 2 hours. They've done the research on that. So, right now in our society, we have a lot of sterility in males. I mean, 50 years ago it was the women. Now today it's the males, with women.
What about when you plug a cord into your iPhone and listen to it that way?
Headphones.
If the cord is hollow, like a stethoscope, it's perfectly fine. But if it's a solid cord, and there's no like hollow area, even an inch of a hollow area, will discharge the EMF. But if it's a cord, sometimes the impulses go right at the cord inside to your inner ear. And look at all these people who are complaining of tinnitus. I mean, tinnitus is off the charts right now. And look at all the people you're seeing in your practice that can't sleep. They can't sleep at night because melatonin production falls. By the way, CoQ10 production falls with electromagnetics as well. Q10 and melatonin are the two most important antioxidants to combat EMF as well as the sun's rays.
And EMF is an electromagnetic field, folks.
Yeah, as well as UV light, the sun's rays. I mean, melatonin is important, and nobody can sleep anymore because there's so many computers and cordless devices in people's homes. And listen, your bedroom has to be your castle. So in your bedroom, you don't want any stereos, you don't want cell phones, you don't want cordless phones, you don't want a TV. You just want everything clean. And, some of my colleagues, like who's the guy in Seattle, Washington, the German guy, what's his name? Oh God, I just have a senior moment. I can't remember
senior moment. Well, you have a right to. You're 70.
Anyway,
you can have one or
70
two.
years old.
You can have one or
in
two.
A Faraday cage. I mean, he's great.
Well, listen, this has been a great discussion. We've covered a lot of different ground, and I know our listening audience has enjoyed this as well. It's just been a very open and transparent discussion. So it was great. I love it. Now, listen, for those of you that are interested in following Dr. Sinatra, it's Stephen with a PH, Stephen Sinatra, just like Frank Sinatra. And Google him, Dr. Sinatra, and I think you have a website.
Yeah, it's heartmdinstitute.com.
HeartMD, but do you
heartmdinstitute.com and Vervana.com.
Vervana's
Vervana. And then there's always drsinatra.com. That's my Healthy Directions company, which deals in the Facebook and the vitamins and minerals, things like that.
Right, and so I would encourage you, and also where can they find your books, Doctor?
Oh gosh, they're all over the place.
Just go to
Amazon is good.
Go to Amazon and just type in Dr. Stephen Sinatra, and he'll have 25 or 30 books he's written. It makes me feel
24, I think. Exactly.
24. I've only done 3. I've got 450 pages written of the next book, which I'm going to divide into about 5 books, because I found that my first books were a couple of 100 pages long each, and kind of overwhelming for people. I have 3 books: Hormone Health and Happiness, Hypothyroidism, Health and Happiness, and then Do a 180 and Join the Wellness Revolution, which is shorter, and everybody likes that little book because they can read it in about 20 or 30 minutes. And I'm going to start. I'm going to start publishing short little article books, maybe a little book on coenzyme Q10, a short one. I know you've written one on coenzyme Q10, which I've read.
Yeah, actually, if you go to the CoQ10 Association, I did a nice monograph for them. It's about 30, maybe 25 pages. But if you Google the CoQ10 Association, you can get it for free. And it's an up-to-date blurb on CoQ10 I did.
Good. Well, we'll do that.
That'll help you if you want to write a book on it.
Well, that I really appreciate your suggestions.
All right. And Dr. Sinatra, thank you so much for joining us today. And everyone out there, there's so much good information out there, so many ways to get healthy and well. And you heard them discussing all of those supplements, the CoQ10, the D-ribose, the cod liver oil, all of those great supplements. So you can always give us a call at 1-800-579-6545. That's 1-800-579-6545 to order your heart health supplements, or you can go to HotzeVitamins.com. That's HOTZE vitamins.com. And it is such a privilege to have had Dr. Sinatra on the program today. It was a great show. Thank you for joining us today here at Dr. Hotze's Wellness Revolution.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.